In 2012, 1.7 million deaths in children under 5 were attributable to the environment. These included 570,000 deaths from respiratory infections, 261,000 deaths from diarrhea, 270,000 deaths from neonatal conditions, 200,000 deaths from malaria, and 200,000 deaths from unintentional injuries. Environmental risks have an impact on the health and development of children, from conception through childhood and adolescence into their adulthood. The environment determines the future of a child. Early life exposures have an impact on their health as adults, as fetal programming and early growth may be altered by environmental risk factors. Environmental risks that children are particularly vulnerable to includes air pollution, inadequate water, sanitation, and hygiene, hazardous chemicals and waste, radiation, climate change, as well as emerging threats like e-waste. Reducing environmental risk could prevent 1 in 4 deaths in children. Worldwide, 11 to 14% of children aged 5 years and older currently report asthma symptoms. Many of these are related to indoor and outdoor air pollution, secondhand smoke, pollens, and indoor mold and dampness. Every year, more than 570,000 children are under the age 5 die from respiratory disease, such as pneumonia. Those pneumonias are linked to indoor and outdoor air pollution and secondhand smoke. Another exposure is unsafe use, storage, and disposal of pesticides, cleaning products, medications, and any hazardous chemicals that can cause acute poisoning among children. Young children are most vulnerable to toxic effects of lead and suffer profound and permanent adverse health effects, particularly on the development of the brain and nervous system. Since young children spend large amounts of time on the ground and frequently put their fingers and objects in their mouths, they have an increased risk of lead exposure. Climate change is a new threat to children's environmental health. Higher temperatures and higher levels of atmospheric carbon dioxide favoring pollen growth are associated with increased risk and rates of asthma. More frequently, heat waves will put children at risk for heat stress and respiratory illnesses. Resources that Kentuckians can turn to for education, questions, concern, and supportive organizations is the Kentucky Cabinet for Health and Family Services, Department of Public Health, the Environmental Management Branch. The branch's mission is to prevent disease by eliminating existing unsanitary conditions and safety hazards in public facilities and private dwellings. The Environmental Management Branch provides training and technical assistance to local health departments throughout the state of Kentucky. The facilities program regulates through annual operating permits and routine inspections to ensure compliance with laws and regulations. The on-site water waste program includes on-site water waste treatment and disposal systems with subsurface discharges, septic tank cleaners, certified inspectors of wastewater systems, certified installers of wastewater systems, and private water supplies. The Kentucky Radon program is made up of a coalition of participating local health departments, universities, and a state office. Since 1989, Kentucky and the EPA have worked together to reduce radon exposure through the application of funds from the State Indoor Radar Grant. In my role as a family nurse practitioner in our community, I am to influence the future by interventions through providing educations, resources, and to provide materials for parents to understand how the environment can directly affect their children's health.